Hi, my name is Ken Cutbush. I'd like to talk to you about the risks of revision total shoulder replacement surgery, specifically the risks of revising a reverse shoulder replacement to another reverse shoulder replacement. It certainly is possible to do. This is an example of one here. This was an infected shoulder prosthesis and it's been revised by me to another reverse shoulder replacement. When I talk to patients, what I talk to them about is the risk of infection. It is higher than in a primary situation. The risk for a primary shoulder to become infected after an arthroplasty or replacement is around 1% or less. In the revision situation, it's certainly higher than that. Nerve injury is always a risk, and it is more so for a revision situation. They can also become unstable, loose or dislocate. The prosthesis can wear out sooner. You can have hematomas, DVTs, lung clots, so on. All those sort of things can happen, including wound infections or wound problems. And of course, there's an anaesthetic. There's a general anaesthetic, and there's always a risk from an anaesthetic when you have one. To put some science behind it, O'Malley et al. Published in the Journal of Bone and Joint Surgery in 2024 a systematic review. They looked at 13 studies, which included 1,042 revision shoulder replacements. If you'd like to look at the actual paper itself, you scan that QR code and we'll take you to that paper. So their overall complication rate was around 20 to 27%. The complication breakdown included instability or dislocation, glenoid loosening, periprosthetic fracture. So by that means a fracture around the prosthesis, either on the humeral side or the glenoid side. Infection, of course, polyethylene fracture. So there's always a polyethylene component between the shoulder replacements in almost all situations. Some shoulder replacements are a bit different. They have maybe a ceramic articulation, but the most common is a polyethylene one, and that can fracture. The component dissociation, so that the components can come apart. That means the actual components, so maybe the humeral tray comes off the humeral stem or the glenosphere comes off the base plate. That's what a component dissociation means. Hematoma, we've already mentioned that. So I hope that gives you some framework to think about what the risks are of having a revision of a shoulder replacement to a reverse shoulder replacement. Thank you for listening.